Good afternoon, everyone. Um, Let me say today the City of Houston Health Department is reporting 114 new cases of COVID-19, bringing the total case count for the City of Houston to 2,570. So again, that's 114 new cases that are being reported today. The total number of people who have passed as a result of COVID-19, the total number now is 31. That is an increase of 2. So we are reporting 2 new cases of people who have passed, bringing our total number in the City of Houston to 31. The 2 new deaths include a white female in her 80s with underlying health conditions who passed away on April the 9th, and a white male in his 80s with underlying health conditions as well, who passed away on April the 7th. I want to send my condolences to both of their families. And as far as City of Houston, as of today, there are 40 municipal workers who have tested positive for COVID-19. That is 40. And I do want to share some positive news. Well, I'm going to leave that to Chief Pena to talk about the Houston fire captain that we've been praying for. Today, the city's 2 COVID-19 test sites are continuing to provide testing to anyone who requests it simply by going to the City of Houston's number and getting your authorization code. I'm pleased to report yesterday the city reached its maximum testing capacity of 1,000, and we anticipate, based on the latest numbers, that we will reach our maximum capacity today, again, of 1,000. So I really want to send to acknowledge the health department, Director Steve Williams and his entire crew, Dr. Persse, and all of them for their hard work in our testing capabilities. While we see a fluctuation in the daily numbers, I want to remind you that the city continues to have some of the lowest positive cases and death of all the major cities across the country. And 1 month ago, today, City Council, we voted to extend the local emergency declaration, and we implemented aggressive measures to blunt the progression of COVID-19 and avoid overwhelming our healthcare delivery system. And it was 30 days ago today that the restrictions were placed on our restaurants, bars, and clubs. Our efforts appear to be working. The social distancing and the stay-home, work-safe order are making a difference and are saving lives. But I also want to make clear that we are still going through the storm, and we are not yet out of the storm. I know Governor Abbott made an announcement earlier today about phasing in the reopening of Texas. I certainly look forward to hearing more of the details, and we are assessing even now the things that he had to say and his executive orders. In the City of Houston, we will continue to take those necessary steps to protect the health and safety of all Houstonians and take those necessary steps to save people's lives. I can tell you without any hesitation that the steps that the city has taken, and when I say that, I'm including Houstonians in terms of staying home, engaging in social distancing, wearing the face coverings, all of those sacrifices that you have made, they are working. They have saved people's lives, if not your very own, and at the same time, they continue to save lives. We have yet to reach our peak. We are still in this storm, but all the signs are looking, and I'm cautious, let me put it this way, continue to be cautiously optimistic. And again, when I'm looking at the daily reports coming from our hospitals, it is in every indication that the hospital systems are able to handle the caseload that are coming into our hospitals, and especially in terms of beds, ICU beds, and ventilators. But let me just say this: if we take our foot off the brake, we can easily start moving back in the other direction. And Dr. Persse and I, we were talking about, I think it was Singapore, that did the same thing. They significantly eased their restrictions, and then the cases started to spike. And the reason why I say this, over the last 30 to 40 days, we have asked Houstonians to make major sacrifices to change their normal behavior. And it has not gone without a great deal of pain. The last thing I would want to do as the mayor of the city of Houston is to change course too quickly, and then we end up seeing things starting to spike. I'm also very, very sensitive to the vulnerable communities, at-risk communities, populations in the city of Houston. We will continue to focus on protecting our most vulnerable Houstonians, and those are people within our city who are living in underserved, under-resourced communities, people in our city who have underlying medical conditions, heart disease, lung disease, diabetes, obesity, sickle cell, recovering from cancer, a weakened immune system, senior citizens. These are individuals that I'm very, very, very sensitive to. And quite frankly, we haven't had enough conversation. And though everyone is anxious to open up our cities and get back to business as usual, the reality is for these vulnerable populations, they were living at the margins before this coronavirus. They're still living at the margins right now. And of all of the 31 cases where people have died in our city, all of them have died from underlying medical conditions. So it's very, very important that we continue to focus on them. And that's why next week we'll be bringing the task force that I have put together to discuss ways in which we will continue to provide education and provide resources to these at-risk, vulnerable populations. And as we think about moving forward and opening up our city, we can't just do it taking into account any one group or one individual. We must take into account our entire city and the diversity of our entire city. And I'm not just talking about ethnicity or religion. I'm talking about the social economic status and the health disparities that exist within our own city. On Monday, I will name a local leader to help lead the city's recovery, and I'll say more about the city's plan to reopen the city as we can now move forward, and that announcement will be made on Monday. For now, I anticipate that we will leave some restrictions as we move forward in place, even through the end of May, and that particularly referring to city operations. And that's including the cancellation of city-sponsored and permitted events. That will continue to go through May. Some city employees will continue to telecommute and work remotely. Quite frankly, the way we are operating right now, those operations will continue to exist through the month of May. What I want to ensure people is that as we move forward, just like we took very measured steps at the very beginning of this process, from the first week in March, then to March 11 with the rodeo, March 17th with restaurants, clubs, and bars, March 24th, the stay-home order. It is important that we take measured steps as we move forward. And those steps should be based on the facts, the medical advice that we are receiving, and that we do it in a very, very measured way as we move forward in reopening our city. To help control overcrowding at city parks, for example, for this weekend, the Parks Department will limit access to parking lots adjacent to the parks. Because again, we want to make sure that we're engaging in social distancing, and we'll continue to employ the same measures that have worked for us over the last 40 days. Parks will remain open, but parks that have gated parking entrances will be locked Friday night and unlocked Monday morning. The goal is to encourage citizens to walk and or bike to their neighborhood parks. It will also minimize gatherings, driving, and parking at our facilities while keeping the parks open. And before I open to questions and bring up Dr. Persse, I want to briefly thank Aramco Americas for donating 30,000 K95 masks to the City of Houston's Health Department, which arrived today. I also want to thank Tito's Vodka. Instead of distilling liquor, it is making, some people are disappointed. Instead of distilling liquor, it is making sanitizer, and today dropped off 130 cases of sanitizer for the city. Both donations come at a critical time when efforts focus on flattening the curve of the virus and protecting lives, protecting police, fire, health, and City of Houston employees who are on the front line of responding to this pandemic. Now let me yield to Dr. Persse.
Thank you, Mayor. And as the Mayor pointed out, as he gave the numbers today, for those of you who have been following our numbers, we had over 100 new cases today, and that is in the neighborhood of what we have seen before, which, if you want to use the concept of a curve, and we've used the analogy of a speeding truck and applying the brakes, what might be happening if once we get to a point where the numbers are relatively consistent, that would be when we have got this truck going at the same speed. It's no longer accelerating, but it's still going at the speed. Now let's imagine that's probably 85 miles an hour, because with 100 and something people being reported as being infected, clearly we've not slowed down. And in addition, we had more deaths to report. So as long as that's continuing, we continue to have a problem. And we're sort of getting our hands around it. And as time goes on and we start moving forward, I think one of the concepts I'd like to get across to the public today is that as an emergency physician, I treat one patient at a time, and I can advise that patient that they need to take this medication at this dose at this time. And when they leave the emergency department, they will get that prescription filled, and I anticipate that they will take that medication at that dose at that time. And if they do that, I have been able to tell them what they can expect to happen. And if that doesn't happen, they need to come back to me. With public health, it's not entirely a different concept. We are advising people about social distancing and wearing the mask. And if they do that, here are the expectations of what you can expect. But the patient, as a community and also as an individual, needs to follow the prescription and the directives in order to get the achieved results. And so as we look forward to society and actually the economy being restarted, I don't know that society is necessarily going to get back to the way it was as quickly as you'd like it to, but the goal is to get the economy going again, which is critically important. We still need to do all of the things that we were doing before. Otherwise, as the Mayor pointed out, it's like taking your foot off the brake at this truck that's already going 85 miles an hour and wants to accelerate. The accelerator remains stuck. The virus continues to want to spread. And for all those folks in the community who have not been infected and have no immunity, that's the fuel for the virus. So I try to use these analogies to get concepts across so that people can understand our situation, because it's vitally important that we continue to take the medicine as it's prescribed, when it's prescribed, in order to get the results that we hope to have sometime from now. Thank you, Mayor.
Chief Pena.
Thank you, Mayor. Thank you, Mayor. So I want to start my report by providing some positive, very positive information here. We have very, very, very good news about our captain that was in the ICU, Captain Capistran. He has now been released from the hospital, and he's recovering at home. So I want to thank the community. I want to thank everybody who offered their prayers, and thank God that he's looked favorably on the Capistran family. In regard to our numbers in quarantine, we continue the trend downward as far as personnel in quarantine. Today we are at 62. As you can remember, as of the 8th of this month, we were up at over 220 firefighters in quarantine. So we're making excellent progress in lowering the number of people that require to be quarantined. I want to thank Mayor Turner for the continued support in my request for expenditures for additional equipment to keep digging that fire break, so to speak, to ensure that we are protecting our firefighters from additional exposure. Recently, as you may have seen in the news, we implemented a new spray decontamination process. This is an enhancement to what we have been doing in the last month or so. And this is going to allow us to better disinfect the working environments and the apparatus and the equipment that our firefighters are working with, which is going to help lower the amount of exposure. In regards to positive tests for COVID-19, in the course of this operation, we've had 29 firefighters who have tested positive. 19 of those have since returned back to work. We have 10 currently still recovering at home. The occupancy task force, we had a slower night last night. We have 52 complaints of personnel not adhering to the stay-home order. We have gotten voluntary compliance, let me say it that way, from every one of the business owners, which is a positive thing. We appreciate the assistance from the community. We understand, as the mayor mentioned, that there is angst to get things back open. But in our enforcement, we found very good compliance, voluntary compliance by the business community, and for that, we appreciate that. So that's my report, Mayor.
Thank you. Chief Acevedo.
Good afternoon, Mayor. Thank you very much for your continued leadership and everything you're doing for our city. The couple areas that we want to start off with, I want to report that Officer Ray Cervantes is still in the hospital, still hanging in there, but still not out of the woods. And the family, once again, wants to thank the community, the Cervantes family, for your continued prayers. And we have hope, and just 10 days ago, we didn't have hope. So please continue to pray for him and everybody impacted by COVID. The other thing I want to report today, the only change we have in terms of our folks that are out on COVID exposure is we hold at 37, but we have another person back up and released to work today, which is good news. And I think that brings us up to 17 that have been released back to work. And we're down to the low 70s as it relates to officers in quarantine. The other area that we want to bring up to everybody very quickly is the area, I'm down to 58 in quarantine from a high of a little over 200 a while back. Assaults continue to be at about 10% up since COVID stay-at-home order and the closure started, the essential business order started, and our burglary of buildings are actually up to 30%. But we are fully functional, fully operating, Mayor, and we're responding to all calls for service and our proactive measures to try to combat crime continue. And so if anyone needs us, please call on us. And that's my report.
Chief Buenik.
Thank you, Mayor, for your leadership and also for providing the numbers to the general public every day so that they can track our statistics just like we are with the city. The Office of Emergency Management's been working hard on all the different task forces that we have within the city, making sure that everybody is providing proper information and getting proper personal protective equipment for the essential city services. I'd also like to thank Aramco in Saudi Arabia for their donations. Anybody else that would like to donate, we have an email that you can send, donations@houstonoem.org, and we'll be happy to set up some deliveries. The Office of Emergency Management's also doing our regular functions. We're monitoring weather this weekend. We're going to probably expect some rain today, but some more severe storms Saturday and Sunday. We've been in contact with HPD, HFD, and Public Works to make sure we have proper resources in place. Lastly, I'd like to let everybody know that this week is National Public Safety Telecommunicators Week. I'd like to acknowledge and thank our 911 operators, our police dispatchers, and the fire dispatchers for the service that they perform every day. Without them, our first responders would be a little bit less safe. So I want to thank all of our telecommunicators this week. We appreciate their service.
Thank you. And I want to echo that as well. That's why I apologize, Mayor, a few minutes late because we were at, Chief Finner and I were over at the Houston Emergency Communications Center actually feeding lunch to our telecommunicators, and I want to thank Landry's for helping us with that, and then the Rockets that will help us with day shift on Tuesday. The one thing that I forgot to mention, Mayor, that we talked about this morning is, just a couple minutes ago, is that the White House actually reached out to us, the executive office of the White House, about 2 weeks ago and asked us if we need a hand sanitizer. And I want to thank the White House for 6,000 gallons that showed up this morning. So we've got 6,000 gallons of hand sanitizer, and I want to thank not just the White House, but UPS for delivering. Go Brown, thanks for getting it to us this morning. We're very happy because that's one of the things that we needed. So thank you again.
Thank you.